So good afternoon. My name is Dr. Kemunto. I'm a consultant psychiatrist in Oasis Specialty Hospital. And this afternoon I would like to speak about a topic that many of us are afraid of, and probably the reason as to why there's been a lot of anxiety during this period of COVID-19. And as there's been a lot of adjustment during this period. But today specifically, other than dealing with depression and anxiety caused by COVID-19, I would like to talk about loss and what does it mean for us in this period of time. So loss can mean many things. Majority of the people associate loss with grief, that is meaning death, but loss can come in many aspects. And in this period of COVID-19, we've seen a lot of people who have had to go through a lot of adjustments because they've had to lose jobs. There's been a lot of unemployment. People have had to lose their housing because they're not able to afford it. Some have had to lose their ability to stay even in Nairobi and to move into local settings. And the greatest scare that we have for COVID-19 is, as much as there's the mild illness, are we going to deal with the loss of our loved ones? And even just not the loss of our loved ones, but dealing with the loss of ourselves, just dealing with the fear that we might die ourselves. And how does this period of COVID-19 change how we look at loss and how we deal with it? These are very unprecedented times. And you see, when you go through something devastating like unemployment or loss of your job or pay cut or the roof over your head, you find yourself that in this period of time we have to deal with loss by ourselves. Previously we had support system, people would visit you, people would come together and contribute some money. But this time around, the social isolation means that every stressor that you're going through it alone. But let's leave loss of jobs and unemployment. How is it that we're going to deal with grief? Because that comparison between the other countries and Africa is that we have not seen so much death that is being experienced, let's say in Europe, that is Italy and Spain, or in the US. We are seeing a milder form of COVID-19 here, but a few deaths here. But it does not mean that some of us will be affected by this loss. And how has COVID-19 changed the way we are grieving? You find now that normally you would be able to bury your loved one, but COVID-19 makes it very difficult. If you die within your quarantine or your isolation, it means the government will bury you. And that means within our culture, closure means being able to have that body and burying it. And it means that there's more peace knowing that you are in that process. But COVID-19 takes that away from us. On top of that, we enjoyed having the vigils where people would come, sing with us, console us, and help us through that process. But COVID-19 means that you're going to grieve on your own and in your own house, in isolation. The pain will be yours. There's that essence of having too much time and overthinking and not being able to adapt. So COVID-19 will be changing the landscape of grieving, and we're going to be dealing with loss in a very different way than we are used to. But how will we be able to go through this? How do we normalize this situation? How do we adapt during this time? How do we grieve and not be able to go into depression or go down into suicidality or feeling that the sense of hopelessness that overwhelms you? This is a time whereby, and we're very grateful that where the country is now, everybody has internet, everybody has a phone, majority of people are able to connect. And this is a time to reach out to your loved ones or those people who know that you've gone through a loss. This is a time to reach out to you and talk to you. Maintain social networks, talk to people through WhatsApp, talk to people through WhatsApp video. Do not isolate, because isolation might risk you to go into depression, into anxiety, or even suicidality. This is a time where we have to come together and help each other cope. Find out what your friend, your neighbor, your relative is going through. Chip in as much as you can, because people are they're going through situations where they have pay cuts or they do not even have a salary and they do not have food. This is a time to share the little we have. For those of us who will have gone through losses of jobs or unemployment or a pay cut, it is a time to now adjust and minimize our plate into something smaller. Adjust our expenditure from where we used to spend so much, but now we need to cut down on costs. It may even mean to move from the house you were living in, whether it's a 3-bedroom house, and adjust to a 1-bedroom house until this period ends. But these stressful times are teaching us ways to adapt, because we must first look at this situation and normalize it, because this is the new normal. Then by that, you do not go into panic or anxiety, but you're able to breathe in and be calm enough to be able to have problem-solving capacity. Because if you're not able to normalize the situation, then the risk of mental disorders will be higher, the risk of anxiety, the risk of depression, and the risk of even being suicidal will be high. So during this COVID time, where we have different ways of grieving, we are allowed to grieve in what way you can. But don't stick there, learn to adapt and change. And since grief has changed, the duration of burying people has changed, let us be there for each other, to support each other by communicating, and more communication using the networks that we have. Don't lose your network. Call your family, call your friends, check on them, support them as we wait to see when this time will pass.